Hip arthroscopy has been around for a few decades now. It's been refined significantly in the last 10 years. So the equipment and technique's been refined significantly in the last 10 years. Typically, hip arthroscopy is reserved for people whose hips aren't very worn out and when there is what's called labral pathology. So the labrum is the lining of the hip joint. It goes around the outside of the hip joint. You can get a tear in the labrum. Now the problem is that even in people who are asymptomatic, labral tears are extremely common. Some studies suggest up to 50% of people who are asymptomatic have labral tears, which makes it a bit difficult for us to sometimes work out what's genuine and what's not. The typical symptoms related to labral tearing are pain in the groin. So particularly the anterior-inferior labral tear has a painful groin, particularly pain with flexion and rotation of the hip joint. As mentioned, pain in the groin, especially with activity with rotating on the hip joint, would be typically what you'd experience. Some people have what's called cam and pincer impingement, so there's a particular positional discomfort in the hip because the hip joint itself is impinging. So a particular position, the hip will come into that position and you'll impinge and have pain as a consequence of that. The hip's a deep joint, so it's quite a long way down to get to it, and it's also a very tight ball and socket joint. So to get into the hip joint, we actually have to put you on a traction table, which looks a bit like a Roman torture tool, but you're asleep, so hopefully you won't feel anything. And the two or three portals are used. Typically, the telescope's about the size of my pen, or the diameter of my pen, a bit longer. And to get into the hip joint, as I said, you apply traction, and then we put a telescope in and inflate the hip joint. As with any arthroscopic procedure, it's very safe, but with the hip joint especially, there's some complications that are unique to hip joint surgery, arthroscopy surgery. In particular, we pump fluid into the hip joint to see where we're going, and if you have a prolonged arthroscopy procedure, the fluid from the hip can actually escape into the abdomen. So that's an unusual complication, but it is unique to the hip joint. Damage to small nerves and vessels around the hip is certainly possible, but unlikely. The main complication, as I see it, is that we might not be able to make you better. If your hip's starting to wear out already, then you may have ongoing problems in the hip joint. Also, again, a small risk of infection, very small, about 1 in 1,000, and a risk of clot after surgery. Because a lot of the patients are younger females, I would tend to give you some blood thinners after surgery, and you'd tend to wake up with calf pumps on to reduce your risk of clotting. You should be able to get up by day one, so I typically keep you in hospital for one night. I'd recommend you use crutches for the first few days until you're comfortable. If you're a sportsman or woman, then obviously it'll be about 6 weeks to 3 months before you get back to doing competitive sport. Again, if the labrum is repaired, that tends to make recovery a bit longer. And if there's what we call cam or pincer lesions removed, then we'd sometimes protect you for a bit longer to prevent the small risk of fracture through those areas. The main controversy surrounding hip arthroscopy is that you need to have done enough of them to be qualified to do them. So I've done quite a few now, and I think that's the main indication. You don't want a junior surgeon doing a hip arthroscopy on you because it's a technically demanding procedure.